Hello everyone, so again my name is Ali. I'm a third year medical student at St. John Hospital located in Detroit, Michigan. My first rotation was family medicine. Honestly, when I first went to that rotation, I didn't have a clear idea like what to expect in that rotation because it's very like general. It's like you see a variety of patients, you see pediatric patients, you see like all patients, female, male, so you don't know what to expect in terms of like what specific group to like kind of focus on. So with family medicine, overall, I loved the environment there. Everybody was just so positive, the residents, the attendings. My preceptor was just amazing. I remember on my first day where like they were assigning every medical student their own preceptor, so they're the attending that's gonna be responsible for that medical student. My preceptor was like known to have the most patients, that they would like just like take most patients and see the most patients. So a lot of like people were like kind of psyching me out, like, oh yeah, you better have roller coasters on your feet because you're gonna be running from room to room. You better be on point because she like my doctor like expects like fast pace. And like it's just like my first like rotation and I've never been through any rotation, so I don't know how much I should give and what should I do and what's expected from me. It kind of like worried me and I was like, okay, so I actually like have to like prove myself. I actually have to like stand out. I have to like try hard, give it my all. I can't slack. I know you have to have that mentality through every single rotation, but to me it was just like she has like this like high standard, like she was that doctor that like wants everything on point. So I go there and that's where I met my preceptor and I was like, hello, my name is Ali. I'm going to be working with you today. And I was like presenting myself and she was like, oh, hi, how are you? And she just tells the MA, okay, let Ali follow you and shadow you and just teach him what he needs to know. I was like, okay, I'm seeing my other medical student friends, like they're with their doctor, they're with their attending, and I'm right there following my amazing MA, which helped me a lot. She also like kind of guided me and gave me some advice to like what my doctor expects from their medical students or from their previous medical students, so that actually also helped me. But me right there just seeing like other like students are already with their attendings like going to patient rooms and I'm there not going to patient rooms, like kind of got that idea in my head like, wait, is it gonna be always like that? Does she not like me? What's the idea? What, like, I didn't know how to feel about it. So then I was like, maybe I should actually show her that I'm eager to want to go to the patient's room. So I would like ask, oh, do you mind if I could go with you to the patient room? And then she would like tell me, no, not yet, just go with the MA. So I do believe that she had a plan, but I just couldn't see it yet. So fast forward, she actually wanted me to like kind of perfect charting and like all about that and how the clinic runs. So the second day came, I was like, okay, you know what, this is another day, let's start again. So I go there, hello, my name is Ali again, I'm gonna be working with you. And she's like, okay, let's go. So I start following around from patient to patient, just like kind of hearing every single thing she's saying, trying to take notes, trying to like look at the chart beforehand, see the patients. If anything was thrown at me, I would have an idea about the history of this patient, what they came for, what they like their last previous visit, what they had, what was discussed in that visit. So it kind of like let me be comfortable when we go in that patient's room. So how I would like present or like the questions I need to ask that specific patient or to answer that patient's questions. And then like she would ask me like pimp me. So pimp me is like a medical term where like when doctors and your preceptor attendings start like throwing at you questions and you just have to answer. So she asked me like, do you know how to read an EKG? I was like, of course, yeah. Even though like I kind of was rusty because I haven't looked at EKGs for a while, but I couldn't say no. I don't know if that's something good or bad, but that's just me, I guess. So she would also like ask me, okay, Ali, go grab me this like document. Do you know where it is? I was like, yes. And of course, that was like my first, second day, and I have no clue where anything is. Like, I don't know where that document is, but I just did not tell her no. I just like, you know what? Yes, and I'll figure it out. Don't worry, yes, I got it and I'll figure it out. Until I actually started learning. But like, the thing that I realized is like, even though that you don't know, it's okay to say that I don't know or I'm not comfortable with. But when it comes to stuff that you might be able to like get the answer in like that short period of time, like for instance, like she's looking for a document, you can just go outside, ask an MA, where's that document, grab it and give it to her, rather than saying, look, no, I don't know where it is. Then she has to walk out of the room, go get the document, give it to the patient. So there's stuff that you can just say, yes, I know where it is, and you can go figure it out. So she's seen like how like I'm always like, you know what, yes, I know how to do this, or I'll figure it out the next day. And then that's where like she's seen like I'm at that same track, like, you know what, at that same speed. I would go back home if she asked me about any topic. For instance, EKGs, how to read the EKGs, I would go back to Boards and Beyond, back to step 1 stuff, USMLE first aid book, read the EKGs, abnormalities, QRS, all that kind of stuff. Make sure that the next day, if she ever asked me about an EKG or she had a patient that had to do an EKG, I would take initiative and ask her if I could read that EKG to her. So she's seen that like anything, any notes she would give to me, or even any questions she had for me, I would also bring it up at the next visit and always like let her know that, you know what, everything you told me, I had it under control, and I actually went back home, researched the topic, and right now you can throw any EKG at me and I will definitely analyze that EKG. She was just amazing. She was awesome. I learned so much from her, and I've seen so many patients. So she had a lot of patients every single day. She had scheduled a lot of patients, and I'm grateful for that because I had the opportunity to see as much as like a lot of patients throughout that rotation. So another story that I actually want to share is that one patient I seen alone, and Dr. Iyer was like, okay, are you comfortable in going, bringing that patient in, putting him in the room, getting a full history, performing a physical exam, and coming back to me and presenting it to me, and then we'll work on the assessment plan. So I was like, yes, for sure, I'm comfortable with that. So I go bring in the patient and took his vitals, went inside the room, and got a full history. So he was there complaining of multiple issues. I think he had a hip problem, shoulder problem, and he also had an ear lesion. So I was there doing a full history, getting his past medical histories, social history, surgical history, allergies, medications, all that good stuff that we learned in our first 2 years in medical school. And then all of a sudden, that's where like the physical exam came in. So I started performing the physical exam. He was like asking for like antifungals because like his foot, and like he was asking for a lot of stuff. So I just had to like kind of organize it all in my head and on the chart. But then when I was doing the physical exam, like actually the lesion was right here in his like outer ear. I was looking at it and it just like kind of did not look right. I guess like you have that like feeling, like it's like not like a technical textbook picture where it looked like a cancerous like squamous basal carcinoma or something, but it just did not look right to me. So I asked him like, how long has this been there for? And he told me actually it's been there for years. I was like, okay, so is it bothering you? He's like, no, it's not bothering me. It's just been there. I just forgot about it. I tried to peel it a couple times. It would just grow back. I tried to like put Vaseline. I tried some antibiotics like Neosporin, all that kind of stuff. Nothing actually helped it, or it didn't work. So did it like kind of regress? Did it get bigger? He's like, I don't know. Like I do feel like it's getting a bit bigger. I asked him like what was his job, and he told me he's a construction worker that works outdoors. And I asked him, do you use any sunscreen? And his answer was no. So when he seen me like asking those specific questions on that concern only, and like I kind of like that was my primary focus, he was like, what are you thinking right here? Like, should I be scared? I was like, no, I don't want to jump to anything, but I just had some like, I know it's there and I noticed it's been there for years, and I just want to get to like bottom of this, like why hasn't it regressed and what's the story behind it. I look into his chart and I noticed that he actually lost some weight. I asked him like, have you been trying to lose weight? Like, are you exercising, or did you change anything in your diet? And the answer was no. So that there is a kind of concern when you have unintentional weight loss. So I go back to my doctor and I do a full presentation, and I also specified and mentioned that lesion right there. So she asked me like, what are you concerned of, or what are you thinking? I told her actually I'm like concerned about like something cancerous such as squamous maybe. So she was like, okay, good job. Let's go look at it, give it a look, and then we'll see what we'll do from there. So she took a look of it, and then from right there when she looked at it, I could read her face, and she was like, yeah, I think we're gonna have to biopsy that lesion. So we took a biopsy of that lesion, we sent it to lab, and it ended up being squamous cell carcinoma. So the whole story of that, it was like one of my first patients that I actually seen alone and did a full physical exam, and like I kind of focused on that lesion where he did not have that much concern. Like he had a lot of concerns and he just like had that it wasn't bothering him. First, which is very important, please, please, please use sunscreen outside. Even if you're just driving your car, use sunscreen. You do not understand how important it is. It's not only about like worrying about wrinkles and all that, it's actually also to protect us from like different types of skin cancer. Another thing that I noticed from this story is like whenever you feel that there's something that's kind of not right or has been there, whether it's a skin lesion, whether it's something that's bothering you, epigastric pain, a cough. I had another patient that actually like came in and he's been having this like cough every single night, and sometimes he wakes up in the morning and throws up, and it became just part of his like routine like for years. And that all eventually with time caused him like ulcers, which can also cause because that acid reflux and you're just like exposing your abdomen and your esophagus with that acid could actually lead to like cancer. So anytime you see something that's not right, please go to your doctor. So that's overall. I don't want to make this video long, but overall, like that's like one or two stories of patients I've seen in family medicine. Besides that, I worked with the residents in family medicine. They were all an amazing team. They all had something going on, and like they were like all just like positive. The attendings, the doctors, it was just like a very positive vibe that I actually loved. And I learned so much from there. And I'm very grateful that was like one of my first rotations, because it kind of like, right now, like I have a broad idea and like I'm like have everything refreshed in my head with everything that's in every single aspect. With like, if right now my next rotation is going to be pediatrics, so I did see a couple pediatric patients at the clinic, so I know how to present them, I know how to take a history, I know how to perform a physical exam on them. So I did gain like a broad idea about all variety of different patients. So I'm glad that was my first rotation. So we'll see like how I'll head to my next rotation, and we'll see like how I'm gonna feel about that. Just a couple tips and advices like I would like encourage to, at least from my experience, I would encourage to all med students is basically when you start a rotation, it's totally fine if it's your first rotation. Any time you do something for the first time, you are gonna feel nervous. This is my first video, and you can see on my face like I'm a bit like nervous or it's something new, but that's totally fine. Just keep going through it, push through it, and you will then get used to it. And you'll love it. Just try to enjoy it. I was waking up at 5 a.m., 4:30 a.m. some days, and I was actually excited to go to the clinic, see the patients, be at that positive vibe, feel that I'm part of the team that's taking care of a single patient. So definitely just, it's okay to be nervous. Keep pushing through. It'll get better, I promise. And try to enjoy every single rotation.